Hi, I'm Dr. Adam Fields. I'm a chiropractor. Welcome to Health and Care. I was recently at a conference and I met such an interesting medical doctor, and I am excited to have him with us today. He brings in integrative medicine and aesthetics from the inside out, from the outside in. He's been an innovator in medical technologies, in nutraceuticals. He's had cable shows. He's actually published. He's had written 11 books. I mean, this guy is one of the top communicators in the country right now, and I'm excited to have him, Dr. Mark Tager. Mark, thank you so much for being with us today. He has this new book. Show us the cover of this new book.
Yeah,
I think it's so
this is
beautiful.
an interesting. So this my new book is Feed Your Skin Right, and it is there you go. It's better to look at that than me
Feed
talking
the
about.
skin. I want to
Feed
feed my
your skin
skin.
right. Feed your skin right.
Speak to me, doctor.
Yeah, it's what I try to do in the book is answer four questions, and these are the same four questions that every woman's ever asked me since the beginning of time. Mainly women, some men as well. What should I eat? What supplements should I take? What topicals should I apply? And what procedures should I have? And that's what the book is built around. And
I love how
how
you break it down for people, make it easy. Okay, this is our categories for helping your skin. Give us a little intro, because a lot of us aren't familiar with the skin.
yeah,
When we're feeding the
101.
skin, where are we feeding it? What is the anatomy of the skin?
Yeah. So there are three layers to the skin. The outer layer is the epidermis, and it has no blood supply. It's got about seven layers, and they start out with cells at the bottom, and then they move gradually to the top, and they lose their nuclei and they shed. Now, all of that is at the top really barrier function, and these cells are kind of wedged together, and we want them to be wedged together. Now, the dermis is the next layer. By the way, the epidermis, this always blows me away. You think it's really thick. It is the width of a hair follicle. So if I could pluck a hair from my head and look at it horizontal in cross section, it would be about 150 microns, and that is the depth of the epidermis.
That's the depth of the epidermis. So
Yeah,
you have the one layer that creates those cells, and then they slowly come up and they get less and less hydrated,
right.
and they
Exactly.
get a little translucent.
Yeah, and then they get dry and they flake off. Now, by the way, as we age, we talk about cellular turnover. So going from the base to the top, it takes in an older person 40-45 days. One of the reasons, by the way, we use retinols is it speeds up that cell turnover.
Mm.
Now, next level down is where all the action occurs. That's the dermis. That's where the blood vessels are, where you'll find the collagen, the elastin, this something called an extracellular matrix that kind of holds everything together. We have also a category, this is a big word, GAGs, glycosaminoglycans. And what they are, these are the like little sponges in your dermis that attract and hold water. And we've also got our immune cells coming from there, and they come out to the top of the skin. So the dermis is where the action is, where the nerve cells are as well. Blood vessels, nerve cells, a lot of the active cells, the collagen, the elastin. And underneath that, you have the hypodermis, and it still has vascularity, but we'll see a lot more fat and a lot more fibrous tissue in that layer. So those are the three layers. And, it's so interesting to me. We spend $134 billion smearing stuff on our faces, trying to drive active ingredients into the skin, when really the skin likes to keep stuff out.
Hmm.
And
It's a block. It's
it's
supposed to block things.
it's supposed to. It's our innate defense system
Hmm.
trying to keep toxins out of the body. So the way we nourish the skin from within is getting those nutrients into the dermis and then
Hmm.
find their way up.
Yeah, it's interesting you mentioned that. I have a CBD line that I was carrying, and they did these studies, and it was a more expensive line because they had skin in the laboratory, and they tested every different way to actually get that deep in. Certain things need to get deep. You get a patch, an estrogen patch that needs to get through the dermis, the epidermis, into the bloodstream. A
Right.
sunblock, you want it to stay on, and there's a whole science about just getting past that block.
Yeah, and certainly there are treatments that work on the epidermis. I mean, when you have a facial, for the most part, you are staying in the epidermis. You are peeling off some of these dead layers of skin, bringing some of the newer skin to the surface. But for the most part, when we talk about skin health and beauty from inside out, we're really talking about getting things into the dermis.
Hmm.
It's interesting. You sit here, 5 to 10% of your blood flow right now is going through your skin.
Amazing.
So you think about that, and it can be more than that at certain times when we want to shunt more blood into the skin. But how do we get these vitamins and minerals, and how do we get these enzymes working? Well, all of that comes from a gut that is able to break down food, to absorb those nutrients, and send them to the skin where they assemble and are
Hmm.
used.
Right. But they say you are what you eat, but really you're more what your body can take from what you eat and extract and create nutrients and deliver.
Well, it's a personalized approach. So if you think about it, there's no other person on this planet with skin that is the same as yours. So your skin, because of your genetics, because of the genetic variants that you've acquired, because of your environment, your exposure to UVA and UVB radiation, your food sensitivities, your microbiome. So all of these are factors, and this is what the book's about. It's about using this great new science. We've learned so much about nutrigenomics and the microbiome and food sensitivity testing. And we know more about drug nutrient depletions, so that when people take certain medications, they deplete important cofactors, vitamins, and minerals. So all of this helps to create a personalized individual plan for each unique individual.
Right. I mean, you wouldn't feed a giraffe steak and you wouldn't feed a lion leaves, right? And if we're as different on the inside as we are on the outside, and our genetics are different, we may need to feed our skin, to use your word, differently.
We
And
have to feed our skin right. The most important word in the entire title of the book is the word right.
mm,
What's right for you may not be right for me.
hmm
So, and I think, there's so many good tests that can inform us of that. For example, nutrigenomic testing. This whole area of our genes and food is fascinating
mm,
because on one hand, our genes determine our taste preferences. Now, you may love cilantro. To me, it tastes like dish soap.
mm,
You may have an ability to handle and break down lactose or alcohol, and
mm,
whereas others don't have that ability to that extent. You may have variations in your genes that require you to be optimally healthy to have more of vitamin C or more of zinc or more of vitamin D
mm.
because you are either not absorbing it as well or you're metabolizing it differently or it's being blocked in your system. So all of those nutrigenomic components determine it. Now, but that's only half the story. The fascinating, this is the great part of the story. And once you get this, you will always see food in a different light. So if our listeners and viewers take away just one thing,
Here it is, people.
here it is, dun, 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 drum roll. It is that the foods that you eat turn on or off your genes.
Mm,
They turn on and off genes that make enzymes and proteins that are important that make you healthy or ill. So everything that you consciously put into your mouth is turning on or off genes. So you have that choice of turning on the good stuff or the bad stuff.
or mutating genes.
Or mutating, right? Because we have this concept of epigenetics, which is the effect that the environment, foods, stress,
Thoughts.
toxins, thoughts have on our genes.
Hmm.
But food's a big part of it.
Right. It's the whole nature versus nurture thing. And we've been dealt a hand of cards, and how do we play them the best?
That's right.
So do you actually, I mean, how does this come into play as far as the genetics go? Do you look at blood type? Do you look at cultural background, ethnic background?
Yeah.
Looking at testing? Are you?
Well, There are specific nutrigenomic tests. I mean, you can basically spit into a tube. They take the DNA, they assess that, they create a report, and that's one piece of the personalization process.
Mm-hmm.
And actually, before you get there, it's diet, 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 and diet. It's what the basics, because both you and I know that neither one of us can recommend supplements that will outdo the harm done by a crappy diet. So you can't out supplement a crappy diet. So because 50-60% of all of this is what we eat, what we choose to avoid, the sugars that cause glycation. We all know we measure hemoglobin A1C. So that's a measurement in the bloodstream of how much sugar has been bound to heme, to red blood cells, over a 3-month period. And when it's really high, that's essentially a marker of diabetes. Well, that same process of glycation takes place in the skin. You eat a lot of sugar, it binds to the collagen and changes its shape and its function. It makes it more brittle. And that's reflected sometimes in some of the lines that we
Fascinating. I'm so anti-sugar. That's another great reason. So it might even interrupt with the fibroblastic activity and actually creating the collagen.
Yes. Well, it's collagen is a fascinating story. So many people today take a collagen supplement, and they, in their mind, they think, I'm going to eat this collagen. I'm just going to go right here.
Please.
It's going to pull everything back. It's going to go right here. But it doesn't do that. Collagen is broken down into the gut into its constituent amino acids. You are recreating that collagen in the skin. That collagen, by the way, needs vitamin C and iron to reconstitute itself. And this is where we see some very nice synergies from outside in to inside out. Where the Fraxel laser was I was one of the early folks from that. I was the chief marketing officer. And what we realized early on is when we brought heat into the dermis, remember that active layer of the skin, we got enough heat long enough we call denature the collagen. So it breaks up, it shortens, and it essentially dies. But it becomes the scaffold on which new collagen is made. And we call that neocollagenesis or collagen growth or remodeling collagen. So now if you are getting enough of those amino acids and you have enough vitamin C and you have enough iron and you're young enough actually for this process to take place, you will remodel your collagen. And those amino acids and the vitamins go to that area of the skin where they had an insult. And the body said, hey, look, we had this insult. Get with it, gang. Let's make some good, healthy, new, young collagen.
Right. You're actually irritating it in a sense.
Yeah. And in fact, in terms of procedures, the more aggressive the procedure, the longer the downtime, the better the result. So many people, in terms of selecting a procedure, is how aggressive do you want to be? Because the more aggressive you are, the bigger and better the result. But the more downtime, the more possibility for a longer healing process. All of that is something to factor in versus a less invasive, a microneedling procedures or microneedling RF procedures where you do a series of 3 or 4 of them over a period of time.
Right. I just did did about 6 months of microneedling and 10 minutes per day massage on my head. I had a yarmulke bald spot basically, and it's just incredible.
I think there is where we inject PRP and we exosomes, where we use topicals like Nutrafol, which are really clinically proven. They've got some, Glynis Ablon is a dermatologist down by me, and she's done some great research on that. This is where some of the topical, they're actually, believe it or not, and I didn't believe this when I first thought, there are exosomes, which are these little signaling molecules in things like ashwagandha, which is an adaptogen, and they've shown that can help. But we're also changing the microbiome of the scalp which is something that's very interesting as well.
Mm.
So it's hard, obviously, a little bit too late for me to, but because it's genetic, but certainly for women going through menopause, I mean,
Mhm.
this is enormous concern. The thinning of the part, the extra shedding, the loss, the thinning of a ponytail, for example.
I get a lot of questions. Postpartum, menopause, losing hair. I'm getting that a lot on my channel.
Yeah. Yeah. So there's a couple of ways you approach that. One is that, as I mentioned, Nutrafol is a really nice preparation for women going through menopause, and there's some others. There's Votess and a few others, but the Nutrafol is the one with all the science behind it. There's also some of the phytoestrogens. Now, you really want to eat a diet high in cruciferous vegetables. Those are the broccoli, the kale, the cauliflower. But there's another product, and again, I have no horse in this race. I just say what I think are some of the better products. But Metagenics has a product called Estravera,
Mhm.
which is they have some good science behind it, and it is a phytoestrogen. So there are natural estrogens in plants that
Mhm.
we harness, and that's one that they've
Right.
extracted. And
Even
that
almonds. Even almonds have
yeah,
estrogen.
almonds, another one. It's interesting to me. I do a lot of work with a non-invasive vagus nerve stimulator company, and we look at migraines, and we put a little stimulator up against the neck, and menstrual migraines. It only takes a 10 microgram drop in estrogen to trigger a migraine for
Mm.
women. And migraines are very closely associated with hormonal changes in women.
Mhm.
So I think whatever we can do to keep those estrogen levels high naturally, I think
Mhm.
that's really
Right.
important.
Right. There are some, it's bizarre. Maybe you can help me out with this because I don't, it seems like
Mhm.
you know more about this than I do. For instance, like cow's milk and dairy, you're going to have more breast cancer, right? And people who have breast cancer that are having 1 to 2 servings of dairy a day, it's been shown that they're more likely to die from the breast cancer. And they say it's because of the estrogens. But there are other estrogens that are actually going to help the situation, right? And decrease cancers.
So, the question becomes when you look at cancer, you have this abnormal expression of these proteins, and what turns them on, what turns them off. For an example, and again, these are large studies, you have to read them with. So there's a study, I'm going to switch over to what I know a little bit more about, which is prostate cancer in men.
Okay.
If you have prostate cancer, there are studies that show that you don't want to eat a lot of eggs because that actually can, statistically, they've shown that can make that worse, cause more reoccurrences, cause certain cancers to grow faster. I think it's hard to figure out the estrogen cancer connection.
Mm.
I know that in menopause or around perimenopause, we really want to get estrogen up every way we can because it is that drop of estradiol, which is the active form of estrogen,
Mhm.
that really is so precipitative that is actually causing the issues, the drop. So I think that there are some plant-based approaches to that.
Great.
Uh,
Speaking
but
of
can't.
speaking of plant-based, let's go into because I know you have such a great knowledge of this. For instance, like with the diet and skin, tomatoes, for instance, or foods that have lycopenes and carotenoids, are there in the plant to help it protect from burning the skin, right? So I've heard eating tomatoes actually it's like a natural sunblock. Have you heard
Okay,
this?
so if you look at that, there's some really good research on this, and I can cite a good bit of it if we want to get geeky, but
Sure.
let's not get too geeky. Uh, I go to my garden and I've got plants of every color because you
Oh,
want to eat
beautiful.
the rainbow. And there are about 5,000 phytonutrients in these plants. These are these compounds. And what's their job? What do? They are there to protect the plants against the harmful UVA and UVB rays,
Hmm.
against pollution, against all sorts of assaults. And the best way to get your phytonutrients is Mother Nature, because she's put this together. They have put this together uh, in such a way that we're getting the right blend, and we can't really duplicate that as well, but we can try. So we do that. So eating a diet rich in phytonutrients is very critical. The studies show that they offer mild UV protection. So if you look at an SPF that might be 30, now they can't make this claim because this is an actual claim, but you're looking at an SPF maybe 3, 4, and then there are some ingredients like Polypodium leucotomus, which is an extract from a fern. There are some of the powerful things like astaxanthin, which comes from is the red algae that salmon eat, and other shellfish. That's a powerful antioxidant. Vitamin C is a reasonably powerful antioxidant. So you look at this, and then of course you've got all the carotenoids, which are all the things that come from orange. Think carrot, think yellow-orange spectrum. So that's what they provide. And xanthine, zeaxanthin, lutein, these are all great ingredients in foods. And they're also great ingredients in supplements as well, because you can extract them, purify them, test them, standardize these extracts, and put them into supplements.
So what you were saying is a copper tone is going to give you a 30. If you eat all these correct vegetables, maybe you get a 3, is what you're saying.
Yeah, but I would go.
It's still good.
I wouldn't go copper tone myself personally.
Right.
First of all, you want to make sure that you're doing a zinc, titanium, a mineral-based sunblock, and not a chemical-based sunblock. We've got women listening to this podcast, watching this today, this YouTube video, who are applying 17 things to their skin each day. Well, I think about it. You wash your hair, you put conditioner on, you've got your body work, you've got body lotion, you've got face lotion, you've got mascara, you've got sprays, you've got lipstick, you've got you go on and on.
Mm-hmm.
So you're already subjecting your body to all sorts of chemicals to begin with. So do you need more chemicals to block the sun when you can do zinc or now the other thing about
I'm with you. It's too much. You're just baptizing yourself every day. It's just
much more chemicals.
The thick mud. I mean, the skin is I've heard it's a respiratory organ. It actually I don't know what that means. What does that mean?
What that means is when they say the skin breathes, that when you are hot, you sweat.
Mm-hmm.
You cool yourself off, but there's always this transfer of nutrients that is going between the dermis and the epidermis, and there's a constant flux. There's also these immune cells that are sticking their little fingers up and saying, there's this little toxin going on right now. I don't like that little toxin. Let's create a rash, because you've developed some sensitivity to that. Your body is recognizing that chemical is foreign. So the thing about sunblock is it's got to be zinc and it's got to be titanium. It's got to be mineral based, but it's got to be the formulation that you like, that you'll use, that feels good to you. It's not that chalky white stuff anymore.
Mm-hmm.
I mean, there are 3 or 4 really beautiful ones on the market. Elta MD is really lovely formulation. Tizo, Elastin makes a lovely finished product, kind of silky and glowy. Color Science has it right in the foundation, so you get your mineral sunblock right in the foundation. So you have to do that. Now, the downside of all this is that we're going out. I got in the garden. I got my hat on. I got my sunblock. And I'm not getting enough UVA, UVB to make much vitamin D in my skin. So that's one of the problems that we have, is that people are not getting the sun exposure that would help them make the vitamin D.
Right.
So many of us, 90, the last study I saw is like 90% of us don't even get the estimated average requirement. We're low in this. And vitamin D is bones, certainly.
Immune system, it's so much.
Skin, yeah,
So
it's
what
a
you are saying, not just the hat, but the sunblock
yeah.
actually changes vitamin D synthesis in your epidermis,
Yeah, you're not
in your
making
dermis. Sorry.
yeah,
Yeah.
you're not making the vitamin D to that
Mm.
extent. And then if you factor in on top of that genetic variations, that there are actually two genes that determine why some people need more vitamin D than others. One has to do with how the vitamin D is bound in and carried in the bloodstream. The other is how it's hydroxylated in the kidneys and made more active. So if you have genetic variants for those two, as actually I do. So I know, as does my daughter who inherited this from me.
Mm.
So yeah, all of us need vitamin D. It just means that I need a little bit more than somebody else. So where someone might get by on, 1,000 international units a day, perhaps I need 1 to 5 or
Hmm.
even more than that. But you also want to track and monitor those things.
Right.
This is the benefit these days. And there's so many, by the way, home tests that you can get. You can
Oh,
get
you can
things
go to a
done,
lab. It's so easy. You don't even need a
or go to a
doctor's
lab. You can
prescription.
go to
It's
exactly. It's
yeah,
people have the power to get the information if
right,
they want.
right.
Yeah,
Yeah, and you want what about like 40 micrograms
yeah. I think you
per
want to get
liter?
up closer to the
Milliliter.
60 range myself,
60.
but 50 to
Okay.
60. But 40 is fine.
40 is good too.
Yeah, but so a lot of people left to their own device. I talk to my colleagues, and they will say they see numerous people in single digits, which
Oh,
is really really low.
not good. Very immunologically compromised.
Yeah,
Very
exactly,
compromised. Yeah.
exactly.
Vulnerable. Big time.
Yeah,
Yeah, you want your vitamin D. Even like getting used to wearing a tank top, taking your shirt off. If you don't, aesthetically, you don't want your face to get wrinkles or whatever, go with your body.
I agree with that. I think the idea of getting out, if you can, of course, if you live in Minnesota and it's the wintertime, you're going to have a hard time with that. But we're sort of blessed in California. We can get out and get a little sunshine. I try to do that every day or so.
It's
Get
nice.
out and leave my sleeves and wear shorts, those kinds of things.
Hmm. So, how do you know? Because there's a lot of, okay, I've got Skin Supplement XL by Johnny James Labs, and this is the one to get, right? And, so many people in America, are saying, well, you've got really expensive urine then, or, I emptied my sewer out and I found nothing but pills in there from grandma. I mean, how do you know what's going to assimilate and work from the inside? I mean, food, as we said, is number one. And if you want to comment more on that, it's great. But a lot of us want to take a little supplement, a little algae, a little microparticulation of some minutia, and have that glowing skin, right?
There you
So,
go. Glow from within.
how do
So
you know we're not just throwing it in the toilet?
well, let's jump back a little bit to look at supplementation. The first thing has to do with quality, purity, and safety. So the gap between the companies that do a great job of producing sustainable, trackable, quality, pure ingredients, pure formulations, it's big. So when
Mm.
you go and you buy things at your supermarket, or if you go sometimes on Amazon and you just don't know what you're getting, you're not sure that if it says 250 milligrams of active substance, that there really is 250 milligrams of active substance. You don't know what fillers, what binders have been put in there. So in general, what I really recommend is if you are working with any kind of professional, you should go for the professional product lines. And a couple of reasons. One is, for the most part, they have done all of this testing, or they are using branded ingredients in which they can track, and go right from the soil and figure out every step along the way to that capsule or their tablet or that liquid or that gummy. So that's the first piece of
Right.
that.
So go to
So
a professional, a
yeah,
professional
and I've
line.
got in the book, I've got a list of the professional companies, and I've got a list of 5 or 6 of the best consumer companies that also really follow this
Well, that's
quality
nice. That's nice.
spec.
Yeah, you also note in your book about how a lot of physicians have a disdain for supplementation, right? they they want that drug, and oftentimes the drugs are actually derived from supplementation, but and that has a patent on it, and then the supplements might not have a patent on it. So you might even have to go to an alternative healthcare provider or alternative healthcare MD,
I
rather than
wouldn't call
just.
them alternative. We would say they're integrative, functional, or complementary. They're not an alternative. I mean, I mean, you need regular allopathic healthcare for regular allopathic things.
Oh yeah.
You break a bone, they're great. You have a
Ex-
heart attack, you have an acute. But I think this concept of an integrative function, the problem with healthcare, and Adam, you know this so well, is that we've got these silos. You've got 12 minutes to explain your lung problem here. You've got 8 minutes to explain your heart problem to the heart doctor.
Mm.
And it goes on and on and on.
Yes,
So
and funny you mentioned it. I know you were an innovator of the hour-long appointment with the MD.
I when I first went into, I created the Institute of Preventive Medicine in Portland, Oregon, because I thought that medicine didn't make sense the way we practiced it. So I said, well, if I were ill, what would I want? I would want to go to one of my colleagues that I really liked and trusted and respected, say, hey, I want to buy an hour of your time.
Hmm.
And so that's what I did. I saw folks for an hour, and then we had classes and workshops, and we had cooking. We would teach nutritious cooking. I taught Monday night yoga, which was really just really a lot of fun. But the point, to come back to the supplement question. So now you'll hear that yes, we have the most expensive urine in the world. And the problem is when you talk to a lot of conventional physicians, they say, oh, vitamins and minerals. It's so much more than that. Yes, many of the vitamin supplements have a lot of the B vitamins in it, a lot more than most of us even need. So you are excreting these water-soluble vitamins, the Bs and the Cs, out in your urine. But that's just a small piece of the skin health and beauty equation. We have all of these phytonutrients, these antioxidants. We have these compounds that are necessary to really fortify the skin or protect the barrier function. So, case in point, well, I get all the vitamin, you're just peeing out these vitamins. True. But let's look at the fish oils. Let's look at the omega-3s and omega-6s. So much of the health-related issues that we have relate to the imbalance between the omega-6s and omega-3s. Now, these are called essential fatty acids. Why are they essential? Why is vitamin C essential in the diet? Because we can't make these substances. They're critical for cellular reactions in the body, but we must supply them in the diet. So the problem is we eat too much corn oil. We lean too much on sunflower and cottonseed oil, and we've disrupted the balance between the omega-6s, which in excess create inflammation in the body.
Hmm.
So if you say, oh, you're just peeing out, these vitamins, no. If you are taking an omega-3 fatty acids, that's critical. If you've got significant inflammation in the body, there are antioxidants and compounds like curcumin that can downregulate inflammation. And it's really fascinating. We're learning more and more how it does that via the vagus nerve.
Mm. Yeah, the interesting thing about the omega-3s is fascinating. As I was for years and years and years, I was 100% vegan. And I started in 2020, I started eating red meat, and a friend of mine's a carnivore, etc. But, he said when we're feeding the cows the corn, right, which is subsidized by the government, they're usually not supposed to eat the corn. It's like the giraffes eating meat. Their bodies get sick, basically, and they have more omega-6s in them, and so it's a pro-inflammatory food. But if you have grass-fed organic beef, it has more omega-3s, and it's actually an anti-inflammatory food. They both look the same. One is an imposter, right? And even like I'm sure the genetically modified corns, etc., with the
Sure.
atrazine, and you put the two corns out, and the birds take the more natural one, right?
Yeah, the other piece of that has to do with salmon. What are we feeding farm raised salmon? We're feeding them corn. Now,
Ooh,
here's the problem
so
with this.
wrong. What is going on here? I mean,
Well, it is the way we sustain the masses. So, and the problem with wild caught, grass fed is the cost. For many people, the cost is really getting to be prohibitive these days. It's
mhm,
it's expensive. But if you cut the amount of those proteins you need
right.
down, so you're not eating them every day or every third, but one's more like once a week, twice a week, you can sustain that. And you are leaning more on other protein sources. You're leaning on chicken, let's say. You're leaning more on eggs. You're leaning more on nuts and seeds combined with whole grains like bulgur and millet and beans, you will get enough protein.
Very good. So yes, and the omega-3, I love how you said essential fat. A lot of
These are
people don't know
so
certain
so
nutrients
I,
are not
I
made
I think that
naturally.
everybody should be taking an omega-3. I have my favorites. I have one that has some curcumin in it for anti-inflammation. There's another really interesting supplement. This is a big word called palmitoyl ethanolamide, PEA, and a product called PEA plus curcumin, which I really like. Enzymedica makes that. And they've got really good studies on inflammation, neural inflammation, and joint inflammation.
Ooh,
And part of that has to do with this concept of, what is chronic inflammation? It is inflammation that has not resolved. It should have resolved, but it didn't. So there's a category of these molecules that are within the fatty acids. I could get geeky on this, but I won't. But the point of it is that these molecules help to resolve and close off and finish off that component of inflammation.
hmm,
So I think this palmitoyl ethanolamide is a really interesting supplement. I've recommended for people with knee problems. It's
hmm,
also good for brain function. You know, we vilified fats for so long. And how many of us went for years throwing out the egg yolk,
hmm,
because it has 300 milligrams of cholesterol? Well, dietary cholesterol isn't what raises serum cholesterol. Those 300 milligrams of cholesterol also have all the B vitamins and all the fat soluble vitamins and things like choline, which are essential for neurological
right.
health,
Hmm,
brain health, and also skin health.
It's interesting you mentioned about the neurological inflammation because I see a lot of people with dementia that I'm doing hyperbaric oxygen therapy, I'm doing shockwave therapy on the brain, I'm doing a lot of things, but you hear these families that go, yeah, she has a piece of cake, and for 3 days she can't think, she can't remember my name, that kind of thing, and it's really serious. There was a study on the antibodies to gluten going
Yes.
right to the cerebellum and affecting the brain. But then you hear people, they say, well, I went to Europe, I went to Italy, I had the pizza there, and I was fine. Is there? I know gluten's a big. Whenever I'm telling people come into my office, we're working on your nose, we're working on your ears. I say, get off the sugar, the gluten, and the dairy. What's your story on gluten? Talk to
Yeah.
us.
Well, let's go to skin first because
Okay.
the dairy and the sugar and saturated fats are the major contributors to acne.
Ooh,
So, and throw in a teenage lifestyle, some hormones, throw in a little premenopause or menopause, uh, get it in a diet that doesn't have enough zinc,
mm,
and that is the recipe for acne, for example. So, there is this blood, this gut brain skin connection, and
mhm,
all these organs are talking to one another. Now, the gluten, about 1% of folks have celiac disease, and they've got the antibodies and they have the genes that are specifically create a disease. And very often, the sad thing is that this disease goes undiagnosed in so many people because the docs say, oh, you just have irritable bowel syndrome, and they don't check for this, despite the fact that, and you can understand it because they come in with these vague symptoms. My gut's rumbling, I have diarrhea, bloating, my skin, and then they can't pinpoint it. Now, another 5 or 6% of folks have, well, 5 times that amount, have non-celiac gluten sensitivity. So, and in fact, yes, there are companies that will measure the antibodies in the cerebellum type antibodies against gluten. And I think there's definitely something to that. And it has to do with the fact that we've modified the wheat. There are more genes in that wheat than there are genes in the human body.
Ooh.
So, I mean, that, they've got us outnumbered. We got 23,000. The genes in the wheat are 40 to 70,000 genes.
Amazing.
So one of the key things is that to remember that when you look at genetics, yeah, it's responsible for how you like the taste of things. It's responsible for lactose, how you handle lactose, and how you handle alcohol, and how you handle sugar. But the foods that you eat are also turning on or off genes, and that's the important piece here. And so often, so we are seeing sugar, gluten turning on and off key genes, and that's what we need to think about. So to clear up the skin, sure, what you're going to do, you're going to minimize dairy, you're going to minimize sugar, you're going to pull out the gluten and see if it makes a difference. You're going to turn and pull out shellfish or almonds or nuts. The problem that I found is that there's so many of these IgG tests, and you take them and they come back, particularly some of the consumer ones, they're very good. But in a reasonable percentage of people, what you see is, oh my goodness, I can't eat anything. Doc, help me out. I'm allergic to this, and this. What am I supposed to eat? Air and water. So for many of those people, what we really have is leaky gut. And, there are so many daily assaults to the linings of our gut. Certainly one of the things we can really do is turn to fiber, which is critical. But there are also other ways that functional medicine doctors heal the gut. Probiotics, prebiotics play a major role in that. And limiting the assaults and getting some of the nutrients that help heal the gut lining. That's a big piece as well.
Right. I mean, you and I both ascribe to Microbiome Labs, and
yeah, I love that. And I love their products. I love them. If you're going to do a probiotic, you want to go for Megaspore. You want to go for a spore-based probiotic. Why? They came from the earth. It resists the breakdown as it goes through the body, so it arrives in a much more functional state. And they have a new product called Serene Skin, which is really nice for acne. And what they've been able to show is that the right probiotics basically help the bacteria, and these bacteria create more of these short chain fatty acids that go to the skin and help with acne. So I think that's and then getting a handle on your microbiome. It's complicated. It's not a simple thing, the microbiome. So if you can have a microbiome test, yeah, there are consumer ones, but I think if you're going to go to the expense and time, you really could use someone to help guide you and explain you. Because what you're looking for is diversity. You're looking for the ratio of different bacteria, and it's really a science. And explaining it's a science as well.
Yeah, I used to do the fecal tests, and yeah, it is quite complex. It's intense. I wait now until it's a severe case that I can't really help, because I tell you, with this Microbiome Labs, the Megaspore and the prebiotic, it's just like, why do $1,000 in tests when I could just go right into bettering your system?
Exactly, and I think most of the really good practitioners take that exact approach. I know you're going to need an immunoglobulin to heal your gut lining, so they've got that product as well. I know you're going to need a really good solid probiotic. So You're right. It's you can spend a lot of money on tests, or you can spend a modest amount of money and do the right things and modify the diet, get those probiotics. Um, you can check for food sensitivities. A lot of people will be able to tell you what they're sensitive to. You
Oh yeah.
can also do an elimination diet, which is really still the gold standard.
Hmm.
Uh, all of that contributes to skin health and beauty from inside out.
Right, right. And the skin, I mean, is the body is really like a almost like a donut, right? I mean, you've got the skin that enfolds into the gut, into this tube in the middle of your body, and
Yes.
that gut is very much related to your skin. And so let's it's interesting because we can go into the treatment, into the diagnosis, and deep into that, and specialize, which is a very important thing. And that's where guys like you and your colleagues come into play. And then you can go into generalizing, right? And trying to find things that work for most people or don't work for
Sure.
most people. And that's my exercise. Like people, why aren't I better? Well, when doing these TMJ exercises, well, not everybody's TMJ is the same. I try and generalize them and make them for the most amount of people. So if you were to sort of make some of those generalizations as we close, and what can we give? What nuggets can you give our people to avoid, run away
Got
from, and run to?
Got it. Let's look at what you avoid. Sugar, 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 and sugar. The average American eats 100 pounds of added sugars each year.
Wow.
100 pounds. Now you're only eating 40, and I'm only eating 40. So that means that somebody's got 160, 150
Right,
pounds. So
right.
a lot of
And
it's hidden. So you
sugar,
really,
somebody told me this once, sugar doesn't occur with high fat, high sugar does not occur in nature even.
no, we don't. You don't see that. You
I
don't
don't
see
see
that.
it.
So, you wanna eat stuff that's not man-made. You want to get it as close to its natural source. You got to do lots of fiber and lots of vegetables and lots of
What a great fishing pole that is that you said, eat as close to the way it was put here on the planet. I mean,
eggs.
there's what people want that ultimate diet is just you're going down the buffet line and you go, okay, what looks the most natural? What's the least
Right.
sullied, the least changed? There you go.
Sure. And then the snacks, the idea of chips and cookies and candies and cakes that are made with hydrogenated oils and all of that stuff is just bad fuel. It's bad fuel for your body and it's bad fuel for your skin. So
Hmm.
you want to have to minimize all that. Look, doesn't mean that, if there's a birthday party, you're not going to have a piece of cake, sometimes, but it just means that 90% of the time you're going to make really good choices.
Right.
The other part of that is that you should actually, I love the fact that people can work with these integrative functional practitioners with good certified nutritionists who with some background who are not there to sell you stuff but are there to help guide you through these tests and interpret things and personalize nutrition for you. So
Hmm.
there's that piece. And then I think that there's some things that pretty much everybody needs. I mean, yes, you need a good multivitamin because the nutrients are not in the soil. Things are being trucked and shipped and oxidized along the way. So a good multiple vitamin is a good thing. I think everybody should be on a fish oil. I think that's critical. I think everyone probably needs some additional vitamin D supplementation. Some people more than others.
Hmm.
And then there are some specific supplements that have been created with classes of antioxidants and ingredients that stack up to create hydration or radiance or firmness. The three or four that come to mind, there's a Neurohacker has a product called Qualia Skin. There's a liquid product called Ethern, Aethern. It's a shot, and it's got some great clinicals by two very well-respected dermatologists on radiance, firmness, and hydration. There's Bend. There's a Skin Aid. There's a number of these formulations specifically for the skin. I think that's important. I think that above and beyond that, the vitamin D, the supplemental vitamin C, if you're not getting enough of it, probably in your multivitamin, but most of them are fairly well
I
loaded.
just do the acerola cherry, put it in my smoothie.
There you go. And that's the other thing. That smoothie in the morning is a beautiful thing. But please don't get into the habit of the juice, going down the commercial juice path, where
Right.
you go and and the reason there is that you're getting lots and lots and lots of fructose. Now it's still better than sugary beverages, but if you overdo it on fructose, that in itself also creates more cholesterol in the liver, extra calories. So water that down a little bit. That's
Right.
what I'm saying.
Maybe
But
natural juices. Do your green juice, get your juicer. You
get your
know,
juice.
you can even buy a used cheap one and just get that celery in there and put maybe even some turmeric.
Exactly. And you know what you do if you interview some, and as I have, some of the most beautiful, incredible dermatologists in the world, 60% of them make themselves a smoothie in the morning and take it to work with them to consume throughout the day. So rather than trying to refuel with junk, and the smoothie, and I've got one of the recipes, Dr. Glynis Ablon, I put her recipe in the book, and it's like, whoa. I mean, what a great way to start the day, because so many people skip breakfast, they have a sugary breakfast, then they have to refuel all day long, and then they have a big dinner late at night, and they don't allow that time for their body to digest and rest and
Right.
repair. And that's the recipe.
Right. The average person's they're eating 17 times a day and they're always in a high insulin state. They're not going
Yeah.
down into that repair state. And yeah, you're not supposed to eat throughout the day,
No,
right? Yeah.
no.
You want to give it the skin time to repair, especially
Yeah.
if you've been out in the sun, etc.
Well, the skin, the brain, the muscles. I mean,
Right.
a lot of reparation, and you got to get a good night's sleep because that's where all of the repair and regeneration takes place. When
Hmm.
in the brain, we have these nighttime gardeners, microglial cells, and they go out and they pare away the damaged connections and they repair some, and they get us ready to learn new things and synthesize. And same way in the skin as well. There's repair that takes place that only sleep can help create a subject that we could talk about, but it's autophagy. It
Right.
is taking out the garbage. It is
Right.
cleaning up cellular debris.
Knowledge is power, right? And your book, Feed Your Skin Right, is just another way. I mean, we know go back to basics, right? We know that. Have your life, your skin, your air, your water, your food as close to the way things are on the planet. But it's hard for a lot of people. Self-control's a bitch, right? So, but with books like yours, we feed ourselves the information. And I know you're curious about life. You're constantly devouring information. In fact, I want the first write of a podcast on your next book. And because I know it's coming soon, but
We should write one together. No, I mean,
there we
I like
go.
author. I think we need to do one together.
We're in it.
We'll split the work, and that'll be great. That way, you'll have the first dibs.
I'm in, doctor. But I encourage people to pick up your book because it'll nudge you further, and you'll find yourself a little bit closer to that, and eating a little bit better, thinking a little bit better, and glowing a little bit more, and that's what we want for you all, right?
Exactly.
Well, I appreciate you coming on the show. You're an inspiration. You have a great joy about you, and your skin looks good too, huh?
Well, it's actually we've got a little bit of a blackout, so I've kept the air conditioning off, so I'm a little bit warm. So,
A little swampy over there.
but thank you so much, Adam. A real pleasure. I certainly enjoyed meeting you. You've got this incredible energy and a great ability to communicate and to heal. I mean, you are truly one of the great healers. So I'm glad we had this time together.
Thanks, Mark. Thanks, Mark. And thank you all for being here with Health and Care. And remember, self-care is high quality, hands-on healthcare. I'm Adam Fields. Thank you so much for being here.